Today, we're diving into something that affects millions of people but is still so deeply misunderstood: depression. We're going to take a journey through the whole landscape of this condition, from its quietest beginnings to its most critical moments, to really understand what it is and what it isn't. So, to really get to the heart of it, let's start with a pretty intense question. How bad can this actually get? We're going to do this a little differently. We're starting at the end, at the most extreme point. Because if you want to understand the journey, you first have to see the destination. Let's go right to the edge. And here we are, at the brink. This is the deepest, most severe stage of the illness. It's a point where that internal storm of depression gets so powerful that it can actually break a person's connection with reality itself. The clinical name for this is major depression with psychotic features. And what's so important to get is that this isn't some totally separate disease. No, it's the farthest point on the depression spectrum where all that emotional pain is suddenly joined by psychosis, a really profound loss of contact with what's real. So what does psychosis actually look like when we're talking about depression? Well, it really boils down to two main things. First, you've got delusions. These are powerful, false beliefs that just won't budge, no matter what evidence you show someone. And second, there are hallucinations, seeing or hearing things that just aren't there. Now, the delusions that come with psychotic depression, they often act like a dark mirror of the depression itself. You see themes of overwhelming guilt, this deep belief that you've done something just unforgivable, or it could be a conviction that you have some horrible, incurable disease, or even this paranoid feeling that you're being hunted down or persecuted.
And with hallucinations, what people experience most often is auditory. They hear things. And it's not just random noise. Usually the person hears voices that are incredibly harsh, critical, and accusatory. They essentially turn up the volume on all those feelings of worthlessness that are already at the core of severe depression.
Okay, but someone doesn't just wake up one day in this state, right? Of course not. It's almost always the final step of a gradual descent. So how does that happen? Let's trace the path back and look at the stages of the illness. Clinically, there's a pretty clear pathway of how this escalates. It often kicks off with what's called mild depression. From there, it can progress to moderate and then to severe. And then, in the most extreme cases, it can end in that psychotic state we just talked about. So at that first stage, mild depression, the signs can be really subtle. It might just feel like a sadness that hangs on a little too long, or maybe you're unusually irritable. It can even show up as physical stuff, like unexplained aches and pains. And that's exactly why it can be so easy to mistake for just being in a bad mood or feeling under the weather. The big shift happens when you move into moderate depression. This is where you see a clear, noticeable impact on daily life. The symptoms are now bad enough that they're causing real problems at work, they're messing with your social life, and they make it tough to handle your responsibilities at home. The illness isn't just an internal feeling anymore. It's actively getting in the way. And then there's severe depression. At this point, the symptoms aren't just there. They are intense. They're relentless. That feeling of hopelessness can become so totally overwhelming that it leads to thoughts of self-harm or even suicide, which makes getting help right away absolutely critical. So we've seen how the illness can get worse, but that just leads to a bigger, more fundamental question. Why does it even start? Let's try to untangle that complex web of factors that can lead to depression. Well, the truth is, there's hardly ever just one single cause. It's almost always a mix of things. Your genetics can play a huge part. We're talking up to 50% of the risk. Then there's brain chemistry, imbalances in chemicals like serotonin and dopamine. But it's not just biology. Things like major life stress, trauma, or a huge loss can be powerful triggers. Same goes for chronic physical illnesses or substance abuse. It's this really complex dance between our brain, our body, and what's happening in our lives. Okay, understanding the causes is one thing, but how do we actually spot an episode, either in ourselves or in someone we care about? For that, we need to know the specific signs that doctors look for. So let's get practical and break down the warning signs. This number is everything. For a doctor to make a clinical diagnosis of a major depressive episode, a person has to have 5 or more specific symptoms, all happening within the same 2-week period. It's not just 1 or 2 bad days. It's a whole constellation of symptoms. And out of those 5 or more symptoms, at least one of them has to be one of these 2 big ones. First, a depressed mood for most of the day, pretty much every single day. Or, second, a huge drop in interest or pleasure in all the things you used to love doing. There's a clinical term for that. It's called anhedonia. The other symptoms that can make up the 5 are pretty wide-ranging. We're talking about big changes in weight, up or down, sleeping way too much or not nearly enough, a physical change where someone is either really agitated and restless or incredibly slowed down. Add to that just constant fatigue, no energy, intense feelings of worthlessness or guilt, not being able to think or concentrate, and of course, recurring thoughts of death or suicide. When you see them all listed out like that, you really get a sense of how this illness can take over every part of a person's life. We started at the brink, we've traced the descent, and we've laid out the signs. Now it's time for the most important part of this whole story, the path back. Because depression is not a life sentence. With the right treatment, recovery isn't just a possibility, it's what we expect. The journey to recovery usually stands on 2 main pillars, and they work best when they're working together. On one side, you've got psychotherapy, things like cognitive behavioral therapy, or CBT, which helps you identify and change negative thought patterns and build new coping skills. And on the other side, you've got medication, like SSRIs, which work on a biological level to help correct those chemical imbalances in the brain. And for the most severe cases, or when other treatments haven't worked, there are other really powerful options. Electroconvulsive therapy, or ECT, is incredibly effective, especially for that psychotic depression we talked about. There are newer therapies too, like rTMS, which use magnetic fields to stimulate nerve cells. And of course, we can never forget the foundation of it all, lifestyle. Things like exercise, managing stress, and having strong social connections. They are all absolutely crucial for getting better and staying well. Which really brings us to maybe the single most important thing to remember. Depression is a serious medical disorder caused by biological disturbances, and the prognosis with treatment is good. Let's break that down. It's not a character flaw. It's not a sign of weakness. It is a treatable medical condition, just like any other. And that right there is the powerful, hopeful truth about depression today. With the right mix of therapy, support, and self-care, that path back from the brink is absolutely there. Full recovery isn't just the goal, it's the expectation. And that leaves us with one final thought. Understanding all this is the first step, but taking action is what really changes things. So the question I want to leave you with isn't just what is depression, but how can we, each of us, start the conversation about mental health today? Thanks for listening.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.